The World Health Organization has scored Nigeria high in its response to COVID-19. It says the country's response is the 4th best in the world. Now, the World Health Organization country representative, Dr. Walter Mulumbo, while speaking in Abuja, the Nigerian capital, commended Nigeria for the successful completion of the first phase of the COVID-19 vaccine rollout. Nigeria has vaccinated frontline workers and other priority groups who are at high risk of COVID-19. Malombo describes the Johnson & Johnson vaccines just received in Nigeria as a game changer in the country's efforts at battling the pandemic. A public health consultant and CEO at Trinity Health Foundation, Dr. NSEABASI Emmanuel EKANEM, joins us here in the studio for more perspectives on this rating. Good morning, Doctor. Thank you for joining us.
Good morning. Thank you for having me.
Good morning. You're welcome.
It's definitely good news then, because for a long time, if we cast our minds back to 2020, there was a lot of dread filled with what would happen should COVID reach Africa and should it reach Nigeria. But to hear that the World Health Organization, the overarching authority when it comes to healthcare, has ranked Nigeria 4th in the world in terms of its response to the virus, to the pandemic, it is a good thing, isn't it?
Absolutely, absolutely. And again, if you look at where we're coming from, then you know that, yes, we've achieved quite a lot. I mean, at the dawn of the COVID-19 pandemic, 27th of February 2020, yes, there were a lot of gaps when it comes to containing disease such as COVID-19 in Nigeria. I think before that, we had this joint external evaluation that tried to evaluate the Nigerian healthcare system with regards to how it can prevent, dictate, and of course contain cases, epidemics. And if you look at the numbers, it was quite appalling as at that time. When we looked at the prevention, I think out of about 13 indicators that we had, we scored about 1.9. And when we looked at, diagnosis, we scored about, I think, 2.5 out of about 20 indicators. And then when we look at, containing it, we scored about 1.5 or 1.3 or thereabout. So where we are coming from wasn't an advantageous position, but how we have been able to contain the COVID-19 virus and, of course, roll out the vaccine with such a huge success is something that is quite commendable. Again, if you look at the fact that as at the dawn of the COVID-19 pandemic, right, we had very few molecular laboratories that could test for, COVID-19 virus. All right, we had one in Lagos, one in Abuja, one in Irua in Edo State. But as I speak to you, we have 84 of those laboratories. So yes, we have achieved a lot. I must say that, yes, there are lessons that we've learned in the course of the pandemic, but give credit to us because we are coming from somewhere we had almost nothing, but now we are able and comfortable enough to diagnose COVID-19, not just diagnose it, but also sequence to know the kind of variant that we have prevailing in the country.
Dr. EKANEM, I mean, I like what you have said, and I am impressed that WHO is saying what they seem to be saying. But I don't understand it. And I want to be clear about it. I mean, 4th as to what? What you have explained to us is about a struggling country, health-wise, medically speaking, which is now not doing too badly. I'm not sure that I see how that makes us number 4 in terms of response. Number 4 after who? After the US, after China, after who? I mean, I'm trying to say, I mean, don't get me wrong. I don't want Nigerians to be discouraged, but I want things to be put in proper perspective.
Exactly.
The vaccines that we have rolled out, the first phase, are less than 2 million or thereabout, or 4 million, but less than 2 million people. Those who have been fully vaccinated are just about 1.5, million. We have not heard anything about the fact that almost half of the second doses got expired while we were still struggling. And I'm not blaming anybody. I'm just saying, is this real, or are they just trying to encourage us so that we buy more vaccines and we keep with the protocols so that things look good and we don't feel discouraged? I don't know what the parameters are to say that we're number 4.
Okay, let me put things in context this way. Okay. Well, when it comes to, the vaccination, the vaccine rollout, I will tell you that Nigeria has done quite a lot. If you look at all the indices from other countries, vaccine hesitancy in other countries is alarming. In fact, in some countries, they had to use incentives. When you come and take a dose of the vaccine, they give you something, money, material resources. But in Nigeria, nothing of such was done. And I tell you, categorically that the first dose was exhausted. We know when we received the 3.9 million doses of AstraZeneca vaccine, what we did was that we divided into two sets of doses so that those who take the first dose can come from their second dose. Yes. The first dose was exhausted. I can tell you that categorically. And then the second dose, we had a lot of people who still came out for those vaccines, despite the fact that at that same period, there were a lot of rumors, there were a lot of misconception, there's a lot of misinformation around the vaccine. So I would say that considering a country like Nigeria, that we know that, I'm not saying that we have a fantastic health system, no, I can't say that. But I'm saying that considering where we are coming from, we have achieved a lot. One would have expected that a country like Nigeria, with our deplorable health system, that we would have had perhaps the worst scourge of the pandemic. But this is not what happened. Okay. And I'll tell you that, truth be told, some of the ways we handled the entire pandemic wasn't quite comfortable. We look at the economic austerity, we look at even the social effect, the psychological effect. Yes, there were gaps, but when you look at it holistically, you see that we achieved quite a lot in the course of the pandemic. And look, nobody's trying to probably cajole us to buy more vaccine. Remember, some of those vaccines that we are even getting are not even bought by Nigeria. It's through the COVAX facility that is procuring these vaccines for Nigeria. So what they are saying is this, that when you look at holistically how we have been able to handle the pandemic from diagnostic to containment, even in the rollout of the vaccine, I'll tell you that we have not done quite badly. If you look at records from other countries, maybe you may be surprised that Nigeria has done quite a lot. And let me add to this. There has been a vaccine nationality. It's a truism across the world. It is not our fault, rather, at this time, that we have not been able to produce a vaccine and probably have access to good doses, good volumes of the vaccine. Within what we had, which was about 3.92 million, we have been able to effectively use it. That is what the World Health Organization is saying. If we had access to more vaccine, perhaps we would have had more expanded access to the vaccine. But within what we had, we are doing quite a lot. And to add to that, we are making efforts to make sure that we have local content when it comes to vaccine manufacturing. It is not a one-day thing. It's unfortunate that Nigeria never thought of this in the past. But now that we've learned lessons, I can assure you NAFDA is working very hard to make sure that Nigeria has the capacity to produce vaccines. I think really, given the situation and the fact that this is a novel disease, coming with a lot of challenges across the world, honestly, I don't think we are doing too badly.
That's good.
With all of the good things that you've said the government has done, Nigeria as a whole has done, I think one place where a lot of us has failed is being able to sensitize the public to the seriousness, the gravity of this vaccine. Still, there are still so many people who are skeptical of the vaccine, skeptical of the virus itself. What do you say to that?
Well, of course, the truth is that we've not really done fantastically well when it comes to disease risk communication, when it comes to even actually reducing vaccine hesitancy. We've not done a lot. And that's why you see, sometimes I keep saying that we have been able to create that gap. And of course, when there's a gap in terms of information, misinformation steps in. And that's part of the lessons that we've learned in terms of managing pandemics, managing epidemics, that there is need for infodemic management, managing the information around the epidemic so that people can get the right information and can take informed decisions, to handle, to make informed choices in response to the pandemic. And well, with regards to that, Nigeria has really not done, for me, I don't score Nigeria very high when it comes to the way we handle information with this pandemic, because you see that we were more reactive than proactive. A lot of times we only react to what people are saying, the rumors that are making the rounds. No. in disease risk communication, you first of all send out information, then update information, and then dispel the misinformation. That is the principle of disease risk communication. And again, we did not involve a lot of stakeholders, I must say that. We have the private sector, we have the public sector, we have the social sector. These stakeholders were supposed to have been galvanized together so that we can actually reach out to the people that need this information the most. Grassroots sensitization, behavioral communication, community engagement was not total as far as I'm concerned. We had some gaps. We have places where people were feeling that the COVID-19 itself was a house. I will tell you that up until October, because as a Trinity Healthcare Foundation, we did a lot of sensitization, went to the grassroots to do a lot of sensitization. We went to Akwa Ibom, went to some other states. One of the things that we discovered was that there's a lot of misinformation as far as COVID-19 is concerned. And unfortunately, there was no concerted effort, that aggression in terms of making sure that the right information goes out to the people, and of course that a feedback, because it's not just a one-way thing, it's a two-way thing. You send out information, you receive a feedback, analyze that feedback and see where there are gaps, and so that you can notice whether your people, the people you are communicating with, understand what you're saying. That we did not do adequately. And I feel that that is part of the lessons that we've learned about the COVID-19 pandemic, and perhaps that will help us in handling other epidemics and other health situations in the country.
Wow, that's a good one. But in 1 minute, what advice will you have for Nigerians? Because it will take a long time for vaccines, the second phase to be rolled out, and it won't go far. Maybe additional 2-3 million people will get. In terms of pharmaceuticals, what further things should guide people in making sure that at least they are not affected by this scourge, even while they are yet to be vaccinated?
Okay, well, I would really encourage Nigerians as much as possible that COVID-19 is not yet, we are not done with it. As a matter of fact, we are seeing even new variants, all right? And it is not likely that the vaccine, like you said, would be rolled, even if it's rolled out today, it's not going to get to everybody today. So what we need to do is that Nigerians should continue to observe the non-pharmaceutical approaches, the public health measures against COVID-19. The social distancing is still valid, and Nigerians should still adhere to it. Hand hygiene is still necessary. The use of face masks is still necessary. Nigerians should not just put up this behavior, maybe probably in front of the law enforcement agent. Nigerians should know that until everybody's safe, nobody's safe. That's the truth about it. I lost a patient to COVID-19 2 weeks ago. Wow. And I know that, in fact, it brought the reality. It reinforced the reality that COVID-19 is still around. And we need to take responsibility. It's not about the public, it's not about the government, it's about us as individuals, because we are the ones that are facing this cause. So we need to adhere to all the public health measures so that we can keep ourselves, our families, and our loved ones free or safe from COVID-19 virus.
Okay.
Thank you very much, Dr. NSEABASI.
Yes.
Emmanuel EKANEM, thank you very much for joining us here today, and thank you very much for your information.